welcome back to our video series on pharmacology. In this video, we'll discuss chapter number 17, Dermatologic Drugs. Learning objectives for this chapter: explain the rationale behind using topical versus systemic drugs to treat skin diseases. Compare and contrast the therapeutic effects of various categories of drugs used to treat acne vulgaris, acne rosacea. Compare and contrast the therapeutic effects of various categories of drugs used to treat psoriasis, inflammation, and itching. Explain how drugs are used to treat alopecia and wrinkles. Compare and contrast the therapeutic effects of antibiotic drugs, antifungal drugs, antiviral drugs. Describe the difference between the parasitic infections scabies and pediculosis and the drugs used to treat them. Describe various types of drugs used to treat skin pain, burns, skin ulcers, and wounds. When given the name of a well-known dermatologic generic drug, identify the trade name. When given the generic and trade names of a dermatologic drug, identify what drug category it belongs to and what disease it's used to treat. When given the dermatologic drug category, identify several generic and trade name drugs of that category. And lastly, when given an ending common to several generic drugs, identify the related drug category. Because of the superficial nature and location of most dermatologic diseases, they respond well to topical drug therapy. This is true for over-the-counter drugs as well as prescription drugs. Now, some dermatologic diseases become widespread and severe and become deeply penetrated below the skin. And at this point, oral drugs that act systemically are given. Alright, now we'll talk about drugs that are used to treat acne vulgaris. Acne vulgaris is the form of acne that is commonly seen during adolescence. It's characterized by having large amounts of oil that harden and block the hair pore, forming a reddish papule. Bacteria will feed on the oil and they will cause an infection. This draws white blood cells to the area, forming pustules, also known as whiteheads. This hardened oil will turn black as it is exposed to the air, forming comedos, also known as blackheads. The drugs that are used to treat acne vulgaris are topical drugs, and these will cleanse away the oil and the dead skin. This is known as keratolytic action. They also act by closing the pores on the skin. This is known as astringent action. They also kill the skin bacteria, anti-infective action. Now, ointments are not used to treat acne vulgaris because of their high oil content will just clog the pores even more. Some examples of some topical keratolytic drugs that would treat acne vulgaris would be salicylic acid, often known by its trade names Clearasil, Stridex, and Fostex. This is an over-the-counter drug that has a keratolytic effect that will remove the oil and the dead skin and help cleanse the pores. So you can also have topical antibiotic drugs that are used to treat acne vulgaris. Antibiotic drugs will kill the bacteria on the skin and are used to treat the pustules of acne vulgaris. And some prescription drugs that are used here would be azelaic acid, also known by its trade names Azelix, Venetia, and also benzoyl peroxide, known by its brand names Benzac, Desquam, and Panoxyl. Other examples of prescription drugs would include clindamycin, also known as Cleocin T, and erythromycin, also known by its trade names Emgel and Iriderm. You can also have topical combination drugs used to treat acne vulgaris. These will contain a keratolytic drug and also an antibiotic drug. And some examples of a prescription combination drug include benzaclin, which is a combination of benzoyl peroxide and clindamycin, and benzamycin, which is a combination of benzoyl peroxide and erythromycin. Some other examples: Clinia, which is a combination of sodium sulfacetamide and sulfur; Duac, which is a combination of benzoyl peroxide and clindamycin; Plexion, combination of sodium sulfacetamide and sulfur; and Sulfoxyl, which is a combination of benzoyl peroxide and sulfur. The other drugs that could be used to treat acne vulgaris are oral antibiotic drugs, and these will provide systemic treatment for cases of severe acne vulgaris. This will travel through the blood to kill bacteria in deeper layers of the skin. And these belong to the tetracycline antibiotic drug category. And some examples of oral antibiotics that could be used here: doxycycline, known by the trade names Vibromycin and Vibratabs; minocycline, also known as Minicin or Dinacin; and tetracycline, known by its trade name Sumicin. The other kinds of drugs that could be used to treat acne vulgaris are topical vitamin A drugs. And vitamin A is also known as retinoic acid, and a deficiency in vitamin A can produce abnormal changes in epithelial cells of the skin, such as those that occur with acne vulgaris. Now, retinoid drugs are structurally very similar to vitamin A, or similar to the metabolites of vitamin A. Now, these kinds of drugs will cause epidermal cells to multiply more rapidly, and this will prevent the pores from becoming clogged. They'll also act by decreasing the inflammation that is associated with acne vulgaris. Some examples of prescription drugs that fall in this category: adapalene, also known by its trade name Differin; tazarotene, known by its trade name Tazorac; and tretinoin, also known by its trade name Retin A. Now, oral vitamin A drugs can also be used for severe acne vulgaris. This is given for severe cystic acne vulgaris that is unresponsive to other drugs and is treated systemically. An example of this kind of drug would be isotretinoin, also known by the name Accutane. This will cause these epithelial cells to multiply more rapidly, and also acts to prevent clogged pores from becoming infected and therefore forming cysts. And it's only used to treat severe cystic acne vulgaris, not the common acne vulgaris. Alright, now we'll move on to drugs that are used to treat acne rosacea. Now, acne rosacea is the adult form of acne, and it's characterized by having a constant blotchy redness, having dilated superficial blood vessels, and excessive amounts of oil on the face. This condition is exacerbated by heat and stress and skin irritations. There are several types of drugs that are used to treat acne rosacea. Those can include alpha receptor agonist drugs. They can include antibiotic drugs, such as azelaic acid, known by the names Azalex and Phenacia; clindamycin, known by the name Cleocin T; and metronidazole, known by the names Metrocreme and Metrogel. You can also use corticosteroids to treat acne rosacea, such as dexamethasone, known by the brand name of Maxidex. Now, the drug metronidazole has both antibiotic and antiprotozoal actions and has many different uses. Topically, it's also used to treat infected decubitus ulcers, which are bed sores. The trade name Flagyl is taken orally to treat dysentery and intestinal infections that's caused by protozoal organisms. And Metrogel vaginal is applied topically in the vagina to treat vaginal infections caused by the bacterium Haemophilus and Gardnerella. Now, metronidazole, in combination with bismuth and tetracycline, is used to treat peptic ulcers caused by H. pylori, a spiral bacteria that is resistant to other antibiotic drugs. Now we'll move on to drugs that are used to treat psoriasis. Psoriasis is a chronic autoimmune skin disorder. It's characterized by having scaly and raised and silvery red patches on the skin, and it's often resistant to treatment. And in this condition, the skin is abnormal at the cellular level. There's an abnormally accelerated rate of epithelial cell division, and this abnormality of these cells causes the cells to produce keratin. There are many different kinds of drugs used to treat psoriasis. The first one we'll go over are topical coal tar drugs. This would include Balnatar, Neutrogena T-gel, and Zatar. And these act by decreasing the rate of epithelial production, and also will help to correct the abnormalities of the keratinocytes, the cells that are making the extra keratin. They also work by cleansing away the dead skin, so they have a keratolytic action. It also will decrease the itching. They have an antipruritic action, and these are available over the counter. Another kind of drug that's used to treat psoriasis are topical vitamin A drugs. Now, a deficiency in vitamin A can produce abnormal changes in the epithelial cells, such as those that will occur with psoriasis. An example of a topical vitamin A drug here would be tazarotene, also known by the names Avage or Tazorac. This is a prescription retinoid drug. This will help to normalize the abnormal production of the epithelial cells. You can also have an oral vitamin A drug used to treat psoriasis. An example of this would be acetretin, also known by its brand name of Soriatane. And this is a prescription drug, and this will act systemically to treat severe cases of psoriasis that can't be controlled with topical drugs. Another kind of drug that's used to treat psoriasis are topical vitamin D drugs. The red scaly patches of psoriasis are caused by abnormal keratinocytes within the skin. Synthetic vitamin D drugs activate vitamin D receptors in these cells to slow their abnormal growth. An example of this kind of drug would be calcipotriene, also known by its brand name of Dovanex. Another type of drug that's used to treat psoriasis are topical and oral corticosteroid drugs. And these act by decreasing the inflammation and itching that is associated with psoriasis. This is often taken for very severe itching. Another type of drug that's used to treat psoriasis are immunosuppressants. Now, this is a prescription drug that will treat moderate to severe chronic psoriasis that hasn't responded yet to other drugs. There are multiple kinds of immunosuppressants. One example of this kind of drug would be the monoclonal antibodies. These would include such drugs as adalimumab, also known by the brand name Humira, infliximab, known by the trade name Remicade, ustekinumab, also known by its brand name of Stelara. Another subtype of immunosuppressants are drugs that will suppress the overreactive immune response. And examples of this kind of drug would include Aleficept, which is known by its brand name of Amaviv, Cyclosporin, known by its brand names of Neoral, Gengraf, and Sandimune, and Sirolimus, also known by its brand name of Rapamune. And this is a drug that is given orally. You can also have immunomodulator drugs, such as Etanercept, known by the brand name of Enbrel. You can also have chemotherapy drugs, such as methotrexate, known by its trade name of Trexol. Another type of drug used to treat psoriasis are psoralen drugs. Now, severe disabling psoriasis may also be treated with exposure to ultraviolet light, in combination with a psoralen drug that's used to sensitize the skin to the effects of ultraviolet light. An example of this kind of drug would include methoxylin, also known by its brand name of oxoralin. Now, this kind of treatment is known as PUVA, psoralins and ultraviolet wavelength A, PUVA. And this combined treatment damages cellular DNA and also will decrease the rate of cell division. There are some other topical drugs that are used to treat psoriasis, and topical drugs for psoriasis will either inhibit the production of cellular DNA or are toxic to epithelial cells. And either one of these actions will decrease the rate at which epithelial cells will divide. Some examples of topical drugs for psoriasis: anthralin, known by the brand names of Trithoscalp and Psoriatec; calcitrol, known by the brand name Fectical; parathione zinc, known by the trade names of Denorex and Head & Shoulders, and these are available over the counter. You can also have combination drugs that are used to treat psoriasis, and these topical prescription combination drugs will contain a vitamin D drug, such as calcipotriene, to slow the rate of abnormal epithelial growth, and also a corticosteroid drug, such as betamethasone, to help to control the inflammation. Some examples of these combination drugs: Neutrogena T-Sal, which is a combination of coal tar and salicylic acid; and Taclinex, which is a combination of betamethasone and calcipotriene. I now talk about drugs that are used to treat inflammation and itching. Now, topical corticosteroid drugs are indicated to treat inflammation and itching that's caused by contact dermatitis, poison ivy, insect bites, and psoriasis. Also, seborrhea, eczema, and yeast or fungal infections. Some common examples of topical corticosteroids: alclometazone, known by the brand name of Aclovate; betamethasone, known by the names Daproline, Daprazone, and Maxivate; clobetasol, known by its trade name of Temavate; chlorcortilone, known by the name Cloderm; Desinide, known by the trade name Desoin; desoxymetasone, known by the trade name of Topicort. Other examples here: dexamethasone, known by the names Decadron and Decaspray; difluorazone, known by the names Maxiflor or Sorcon E; fluocinolone, known by the brand name of Capex; fluocininide, known by the name Lidex; fluorandrenolide, also known by the name Cordan; fluticasone, known as Cudivate; and halcinonide, also known by its trade name of Halog; halobetazole, known by the trade names Ultravate; hydrocortisone, known by many names including Dermalate, Westcort, and this is available in both prescription and over-the-counter strength; mometasone, known by the trade name Elocon; prednicarbate, known by the name Dermatop E; and triamcinolone, known by the name of Kenalog. A quick note about the drug Elocon or mometasone. Mometasone is used to treat skin inflammation in addition to being able to treat asthma under the trade name Asmanex Twisthailer. It can also be used intranasally as a spray to treat allergic rhinitis. This is advertised as the brand name of Nasonex. Another kind of drug that's used to treat inflammation and itching are antihistamines, and these will inhibit inflammation and the redness and the itching due to the release of histamine. And histamines are released during an allergic reaction, such as contact dermatitis. Now, as a group, these drugs are known as the antipyretic drugs, and the term pruritus is a Latin word that means itching. Some examples of antihistamine drugs that would treat inflammation and itching: diphenhydramine, also known as the very popular brand name Benadryl; doxepin, also known by the trade name Zonulon; hydralazine, known by the trade name Vistaril; levocetirizine, known by the brand name of Zyzal; and promethazine, also known by its trade name Phenergan. Some other topical drugs that are used for inflammation and itching, and these are all available over the counter, such as colloidal oatmeal, known by the brand name Aveeno; Burrow solution, that was created by Dr. Karl Burrow, a German surgeon from the mid-1800s; calamine, and zinc oxide. You can also have topical combination drugs for itching and inflammation. There are multiple possible combinations you can have. Some could include a topical antihistamine, such as diphenhydramine, to reduce the itching. You could have an astringent drug, like calamine or zinc oxide, to decrease the oozing and the exudates. It could also include a topical anesthetic drug, benzocaine, to relieve the itching and to numb the skin. Some examples of a topical combination drug, Caladril, which is a combination of calamine and diphenhydramine, calamicin, which is a combination of benzocaine, calamine, and zinc oxide, Zeradril, which is a combination of zinc oxide and diphenhydramine. Alright, now we'll talk about drugs that are used to treat alopecia. Now, alopecia usually begins in middle age, and inherited tendencies can cause it to occur at an earlier age. Now, in women, this can begin with the onset of menopause. That's because the levels of estradiol are lower than the levels of androgens. This causes the hair to thin. In men, it can be caused by a lower testosterone. It can be caused by a decreased blood flow to the scalp. This can cause the hair follicles to shrink and will lead to male pattern baldness. So the hair on top of the head eventually will disappear. So this will eventually leave just a fringe of hair at the back of the head. Now, drugs are used to treat mild to moderate alopecia. And these are not effective in all cases, and these must be continued indefinitely to maintain any level of new hair growth. And there are two different therapeutic effects. An example of a drug used to treat alopecia, finasteride, also known by the brand name Propecia. And this drug blocks an enzyme that must be present in order to produce DHT. Now, healthy scalp hair follicles contain a small amount of the substance, DHT, and then shrinking hair follicles on a balding scalp contain a high level of DHT. So you want to keep the levels of DHT lower to keep the hair follicles healthy. Another drug that treats alopecia is minoxidil, also known by its brand name Rogaine. And this works by dilating the arteries in the scalp to increase blood flow. And this will help to stimulate hair growth. Now, the oral drug Propecia is not approved for use in women because of its connection with male hormone testosterone. So women are not advised to take Propecia. And they are also warned not to even handle finasteride tablets when they are pregnant because of the risk of birth defects in the male fetus. However, the topical drug minoxidil is approved to treat both male and female alopecia and does not cause birth defects. Alright, now we'll talk about drugs that are used to treat wrinkles. And there are many different kinds of drugs that are used to treat wrinkles. They can include topical vitamin A drugs. They can include muscle relaxant drugs to relax the muscles that pull the skin into wrinkle lines. They can include filler drugs to plump up the skin to minimize the wrinkles. Other kinds of drugs that are used to treat wrinkles are injected under the skin, where the effects can last for several months. And some examples of this would include botulism toxin type A, also known by the brand name Botox, calcium hydroxyapatite, known by its brand name Radius, and also human collagen, which is sold under the trade names of Cosmoderm and Cosmoplast. Some other examples: hyaluronic acid, also known by their brand names Juvederm and Restylane, poly-L-lactic acid, also known by its trade name Sculptra, tazarotene, also known by its trade name Avage, and tretinoin, also known by the trade name of Renova. Alright, now we'll talk about drugs that are used to treat bacterial infections of the skin. Now, bacterial infections of the skin occur anytime that the skin is broken. Bacteria are always on the surface of the skin. Superficial abrasions, cuts, and burns that become infected are treated with topical antibiotic drugs. And these drugs are used to treat skin infections that develop as a result of skin diseases, such as Acne vulgaris, contact dermatitis, and also because of bacterial invasion into areas of fungal or viral skin infection. A group of drugs used to treat bacterial infections of the skin are topical anti-infective and antibiotic drugs. And these are available in prescription strength and in over-the-counter strength. And these are used to treat superficial bacterial skin infections. And the way they work is they inhibit the growth of bacteria, or they kill the bacteria by blocking their ability to maintain a cell wall. So these can be bacteriostatic or bactericidal. Some examples of topical anti-infective and antibiotic drugs: bacitracin, gentamicin, mupirocin, also known by the trade name Bactroban, retapamulin, also known by its trade name Altabax, and sulfacetamide, also known by its trade name of Ovase. Another way you can treat bacterial infections of the skin is with topical antibiotic combination drugs. These are over-the-counter combination drugs that will contain 2 or 3 topical antibiotic drugs, such as bacitracin, neomycin, polymyxin B, for example. See, some examples of this kind of combination drug would include Neosporin Original, which is a combination of bacitracin, neomycin, and polymyxin B, and then Polysporin, which is a combination of bacitracin and polymyxin B, and also triple antibiotic, which is a combination of bacitracin, neomycin, and polymyxin B. In this image, we have an example of all three of those last drugs that were just mentioned. Of course, neosporin here on top, triple antibiotic here, and then polysporin. And all three readily available over the counter, and all three very, very good, very effective antibiotic ointments. Another possible combination you can have would be drugs that contain three antibiotic drugs, such as bacitracin, neomycin, polymyxin B, and an anesthetic drug like lidocaine or pramoxine to treat the bacterial skin infections and also to control the pain. An example of this kind of combination would be lanabiotic, which is a combination of bacitracin, neomycin, polymyxin B, and lidocaine. Neosporin plus pain relief is a combination of bacitracin, neomycin, polymyxin B, and pramoxine. Another way you could treat bacterial skin infections is with systemic antibiotic drugs. Now, this is for serious or widespread bacterial infections of the skin. So if this is the case, an oral or an IV antibiotic drug would be prescribed. All right, now we'll talk about drugs that are used to treat fungal and or yeast infections of the skin. Fungi and yeast will grow in areas that are dark and warm and moist. So some areas of the body that are at risk include the feet, perineal area, groin, underarms, and scalp. Some common examples of fungus infections would include ringworm, such as Tinea capitis and Tinea corporis, athlete's foot, which is Tinea pedis, jock itch, which is Tinea cruris, and then fungal infections of the nails. And this is formally known as onychomycosis. When it comes to yeast infections, these are caused by the Candida albicans, and this is most frequently will occur in the mouth, the vagina, and in the skin in the form of a diaper rash. Fungal and yeast infections can be effectively treated with topical antifungal and anti-yeast drugs, because these both will alter the cell wall of the fungus or the yeast, and can also disrupt the enzyme activity resulting in the cell death of the fungus or of the yeast. Now, some drugs that are used to treat fungal infections are also used to treat yeast infections, because they are very closely related biologically to one another. So what works on one usually works well on the other. Now, some examples of some topical antifungal drugs, and these are both over-the-counter and prescription-strength drugs that are used to treat superficial fungal infections of the skin or of the nails. And some examples here would include butanafine, also known by the brand name Lotrimin Ultra, cyclopirox, known by the names Loprex or Penlac Nail Lacquer, clotrimazole, known by the brand names Cruex Cream, Desinex Cream, and Lotrimin AF 1%, and also econazole, known by the brand name of Spectazole. Some other examples: efinaconazole, also known by the brand name Jublia, ketoconazole, known by the brand names Nazoral AD, Zolagel, luliconazole, also known by its brand name Luzu, and meconazole, known by the brand names Lotrimin AF 2%, Mycotin, and Ting 2%. Other examples: naphthafine, known by the brand name Naftin, oxaconazole, known by the brand name Oxystat, ceritonazole, known by the name Retaxo, and sulconazole, known by the brand name of Exelderm. Some other examples: terbinafine, also known by the names Desinex Max and Lamisil AT, tolnaftate, known by the brand names Aftate, Tenactin, and Ting 1%, and undeselenic acid, known by the trade names Cruex and Desinex. Now, all of these over-the-counter trade name antifungal drugs are used topically to treat fungal infections. Even though the trade names are very similar, they're actually completely different generic drugs. So this can cause confusion on the part of healthcare workers and with consumers. For example, in this picture we have an example of clotrimazole, which is Lotrimin AF. So this is given as a cream to treat infections for ringworm, which is a fungal infection of the skin and of the body. Miconazole is also known as Lotrimin AF. This is given as a powder spray and powder. So both the last image and this image are examples of Lotrimin F, but the generics are different. So the first image was clotrimazole, and this image, the generic, is miconazole. So another way you can treat fungal and yeast infections are with systemic antifungal drugs. And this is when the fungal infections penetrate deeply into the skin or deeply into the nails, or they cover a large amount of area, or they are particularly severe, and they have to be treated systemically. Next we'll talk about drugs that are used to treat viral infections of the skin. There are several different types of viruses that can cause skin infections, such as herpes simplex virus type 1, which will lead to cold sores. Herpes simplex virus number type 2, this will lead to genital herpes. Herpes zoster virus, this is what leads to chickenpox and then later on in life shingle. HPV, human papillomavirus, this is the cause of common warts and also of genital warts. Now we'll talk about drugs for herpes simplex virus type 1. And this infection only involves the face and the mouth, and these blisters are commonly known as cold sores. The drugs that are given to treat this virus will interfere with the cellular DNA synthesis, and it keeps the virus from reproducing. And there are prescription drugs, and there also are over-the-counter drugs. Some prescription drugs here: acyclovir, also known as Zovirax; famciclovir, also known by the brand name Famvir; penciclovir, known by the brand name Denavir; and valacyclovir, known by the brand name of Valtrex. An example of an over-the-counter drug used to treat herpes simplex virus type 1 would be docosanol, which is also known by the trade name of Abreva. Drugs used in herpes simplex virus type 2. These are infections that are sexually transmitted, and these are often known as genital herpes. These are available in a prescription form only, and these drugs will include acyclovir, Zovirax, famciclovir, also known as Famvir, and valacyclovir, also known as Valtrex. Now, regarding the herpes varicella zoster virus, now these drugs are needed because of the reemergence of the same virus that causes chickenpox. After the initial infection as a child, the virus will remain dormant in the body. Now, later in life, when there is a high amount of stress or illness, that will trigger the reemergence, and it will produce very painful lesions. At this point, this condition is now called shingles. And there are different forms of drugs that you could give to treat the herpes varicella zoster virus. Some are oral. These will prevent the virus from reproducing. And these will work systemically through the blood and in the deeper tissues of the skin. And these are prescription drugs. These examples would include acyclovir, famciclovir, and valacyclovir. Regarding topical drugs, these will not treat the viral infection, but they will only treat the pain associated with the lesion. So these will exert a local anesthetic effect. And some over-the-counter drugs that fall in this category would be capsaicin, also known by the trade name Capsin or Zostrix, or in a stronger prescription form would be lidocaine, also known by that trade name Lidoderm patch. When it comes to drugs regarding HPV, human papillomavirus, now, HPV causes both common warts and genital warts. Now, there are over-the-counter and prescription keratolytic drugs that are applied topically, and these can treat both common warts and plantar warts. These will remove dead layers of the skin, which then will remove the wart. And these drugs can also be used to remove corns and calluses and skin plaques that are associated with psoriasis. Some examples of these kinds of drugs include monochloroacetic acid, known by the trade name Monochlor, and salicylic acid, known by the trade names Compound W and Dr. Scholl's. Now, prescription drugs are applied topically or injected to treat genital warts. And some examples of these kinds of drugs would include imiquimod, also known by the trade name Aldera; interferon alpha 2b, also known as Intron A; interferon alpha N3, also known by the trade name Alferon N; and monochloroacetic acid, also known by the name Monochlor. Some other examples: podophylox, also known by the trade name Condylox; podophyllum, also known by the name Podocon 25; and trichloroacetic acid, also known by the name Trichlor. Alright, now we'll talk about drugs that are used to treat scabies and pediculosis. Now, these drugs are used to treat parasites that cause the infections in the skin. Scabies are treated with scabicides, and pediculosis are treated with a pediculicide drug. Alright, we'll first start off with scabies. This is caused by tiny, barely visible parasites called mites, and they will tunnel underneath the skin and cause itchy lesions. And they also will lay eggs under the skin, which then hatch within a week and continue the cycle. Now, these lesions occur on the trunk, the pubic area, and in skin folds, but the scalp is rarely affected. And these can be transmitted through contact with furniture, clothing, bed sheets, towels, close personal contact, or sexual intercourse. The drugs that would be used to treat scabies are topical prescription drugs. Those would include crotamitin, also known by the trade name Urax, Lindane, and permethrin, also known by its trade names Elamite Acticin. Regarding pediculosis, this is caused by an infestation of lice and also their eggs. These can be found on the scalp, the body, and in the pubic area. And the lice will feed on human blood. And the bites from these lice will cause severe itching. And the eggs that are laid by these lice get attached to body hair, in particular on the scalp and in the pubic area. And lice is easily transmitted from one person to another by sharing hairbrushes, combs, hats, headphones, towels, clothing, upholstery, carpets, close personal contact, and sexual intercourse. Topical prescription drugs used to treat pediculosis include ivermectin, also known by the trade name Sklice, Lindane, malathion, also known by the brand name Ovid, permethrin, also known by the name Elamite, and spinosad, also known by the brand name Natroba. You can also use combination topical drugs to treat pediculosis. And over-the-counter drugs will contain two pediculosis drugs, and these two drugs are pyrethrin and pyperenil. And some examples of these combination over-the-counter drugs would be Rid and Tycet. Alright, now we'll mention a drug controversy regarding lindane. Now, lindane is used to treat both scabies and lice, but only if other drugs have been ineffective. So lindane is never the first choice of treatment. In the past, lindane was an agricultural pesticide, but its use was discontinued by the EPA in 2006 because runoff from the fields caused toxic stream pollution. However, despite reports of causing illness and even death, the FDA allowed lindane to remain on the market as a drug. Now, lindane is not prescribed for pregnant women or children under 2 years of age or the elderly because of its possible effect on the central nervous system, because it can lead to seizures. The drug is actually stored in the fat and can be present in breast milk. Alright, now we'll talk about drugs that are used for topical anesthesia. Now, these will provide just brief periods of anesthesia, and they will have a limited depth in the skin. And the way they work is they block movement of sodium ions across the cell membrane, and therefore stopping the nerve impulse transmission. Alright, and these topical drugs will provide temporary symptomatic relief to treat postherpetic neuralgia, which is the pain associated with shingles, from abrasions, minor burns, cold sores, rashes, sunburns, eczema, and insect bites. Some examples of these topical anesthetics would include benzocaine, known by the trade name Dermaplast, Dibucaine, also known by the trade name Nupercanol, lidocaine, known by the trade names Lidoderm, Xylocaine, and Zingo, and Pramoxine, known by its trade name Tronothane. You also have a topical combination anesthetic drug. And these combination drugs will contain 2 or 3 topical anesthetics. And this is used to prevent the pain during procedures that involve the skin, such as a biopsy, or removing of a skin lesion, or the insertion of an IV line. Some examples of these combination drugs would include Acetocaine, which is a combination of benzocaine, butanban, and tetracaine, and also EMLA, which is a combination of lidocaine and prilocaine, and Cinera, which comes in the form of a patch, and this is a combination of lidocaine and tetracaine. Alright, now we'll talk about drugs that are used to treat burns, skin ulcers, and wounds. Burns, skin ulcers, and deep wounds present unique problems in medical management, because they may contain a large amount of necrotic tissue that must be removed before new tissue can form. And the affected area may produce a large amount of exudate that can become infected and must be removed before the healing can occur. Now, some examples of topical drugs for debridement, which is the removal of tissue, include topical enzymes. And these work because they dissolve the necrotic tissue and the scar tissue. These will help allow new tissue to begin to form at the base of a burn, of an ulcer, or of a wound. These can come in the form of a prescription or an over-the-counter drug. Some examples of prescription drugs would include collagenase, also known by its trade name Santil, papain, also known by its trade names Panafil and Accuzyme, and trypsin, known by its trade name of Granulex. And an over-the-counter drug of this type would include dextronomer, which is sold under the trade name of Debrasan. You can also use topical drugs to absorb the exudate, and these over-the-counter topical drugs would absorb the tissue fluid that flows from damaged tissues and wounds. And some examples of these would include Duoderm and Sorpsan. You can also have topical drugs that will help stimulate granulation, which is the formation of new tissue. An example of this kind of drug would be Bacaplermin, which is sold under the trade name of Regranax. And this is used particularly for skin ulcers in diabetic patients. And it contains a growth factor that is derived from human platelets and produced with recombinant DNA technology. The other kind of drug that you could use are topical anti-infective drugs for burns. These are specifically used to treat extensive burns and to keep them from being infected. And some examples of this kind of drug would be Mafenide, which is also known by the brand name Sulfamalon, nitrofurazone, also known by its trade name Furacin, and sulfadiazine, also known by its trade name Silvadine. Some other topical drugs for burns and wounds include a chlorophyll derivative. It's also known by the brand name Chloresium. And this is an over-the-counter drug that promotes healing and neutralizes the odor from wounds. And another example of this kind of drug would be Manuka honey, which is known by its trade name Metahoney, and is taken from actual honey. Okay, that brings us to the end of this video on chapter number 17. We will continue our video series on pharmacology with our next video on chapter number 18, ophthalmic drugs.